Some veterinarians work with communities and private or public agencies to ensure the health and well-being of animal populations housed in shelters. This field is called shelter medicine and is dedicated to the care of homeless animals in shelters or other facilities that hope to find these animals new homes. Shelter medicine is a relatively new concept. Historically, animal shelters were little more than processing centers where dogs and cats were either adopted or euthanized within a few days. Pets coming in with any signs of injury or illness were generally euthanized immediately. With the rise of the no-kill movement and the decline in shelter intake in the 1990s, many shelters began to house animals longer and to treat pets who were sick or injured. In these shelters, veterinarians are a must if adequate care is to be provided. Almost all veterinary colleges now provide shelter medicine education as part of their curriculum. Veterinarians in shelter medicine write policies and protocols for vet techs, kennel attendants, adoption counselors, and volunteers. They provide wellness programs for healthy animals, direct treatment or rehabilitation plans for sick animals, and perform corrective surgery on animals in need. They also ensure that animals are properly housed. These vets also make sure that the cleaning, handling, vaccination, and quarantine protocols are followed, and they verify that behavioral needs such as rehabilitation, enrichment, exercise, and companionship are met. If a veterinarian spots deficiencies that puts an animal's physical or mental health at risk, it is his or her responsibility to report such findings to the shelter administrator and to recommend changes. While the veterinarian may not have the authority to make the changes in all cases, as a shelter's medical expert, his or her opinion should be very carefully considered, just as one would listen to legal counsel or to the chief financial officer in the corporate world. Accepting the caring responsibility for a shelter population presents challenges rarely faced in private practice. Many of the animals entering shelters arrive with little to no medical history and may be stray, feral, or victims of cruelty. Arriving from many locations with different life experiences and exposure histories makes this a population at higher risk for infectious diseases and problem behaviors. This is further compounded by high-density housing and the stress associated with confinement, making proper behavioral care a crucial part of shelter animal health. It is a job of the shelter veterinarian to ensure that the best physical, mental, and behavioral health procedures are followed for the shelter's entire animal population.